Good evening, everyone, and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. We are living in unprecedented times, no doubt. COVID-19 has tested us physically, mentally, and definitely spiritually. And as we look ahead to this new normal, many of us have questions about what exactly that's going to look like. Tonight, I am once again joined by Dr. Todd Ellerin, Director of Infectious Disease here at South Shore Health. Thank you for joining us, Dr. Ellerin. We want to encourage viewers at home this evening to send in their questions regarding COVID-19. This is your opportunity to talk to a doctor who's had frontline experience and can give you his insight on this virus. So again, Todd, welcome so much, and thank you so much, I should say, for joining us.
Good to be here, Kristen.
Yeah, it's really great to have you. For several months now, our country has been battling this virus. What exactly have we learned about COVID-19?
Well, I think in the very beginning, many of us, including myself, were thinking that this was just going to be a bad flu. But, really over time, we've seen that this has characteristics of influenza, meaning it's highly contagious. And some people think it's even more contagious than flu. And it also, for a small part of the world, but big numbers, when you think of it, can be deadly, like SARS. SARS was that first novel coronavirus we met back in 2002, 2003. So when you look at this, it's really it's really been a bad actor. It's destabilized individuals, it's destabilized countries, and really most of the world. So it's definitely been unprecedented. I think the last time we saw something like this would be 1918. So most of us were not around for that.
Yeah. And the reports in the news are saying that Massachusetts is starting to see a downward trend in this. Is that indeed what you're seeing at the hospital?
It's very true. We've been lucky because there are a number, over 20 states in the United States are still increasing cases. So in Massachusetts, we have seen a decrease. We've seen a decrease in our own hospitalizations, and at South Shore Health, that's true, significant. We've seen decreasing deaths, which, thank God about that, and more patients being discharged from the hospital. So things are going in the right direction in Massachusetts. I do want to thank the community because the shelter in place has undoubtedly saved the most lives of any measure that we've done. Obviously, we don't have, perfect therapies right now. We don't even have we do have individual therapies, but nothing has been proven as a cocktail yet. So really that stay-at-home guidance, that social distancing, that's really been what's working. So I just want to thank the viewers and thank the community.
Yes, we're doing their part.
Yeah.
I have a feeling we're going to get a ton of questions. So I want to get to the first one this evening. Michelle wants to know, on behalf of her son, is it safe to ride with a friend in the car, even with a mask? Or is it, that's what Michelle wants to know, is it safe to ride in a car with her son or with friends wearing a mask? Should they be wearing a mask? What's your advice?
So there's going to be a lot of questions about individual circumstances, and it's important, but remember, a lot of it comes down to individual risk. So what I want to emphasize is, number one, are the kids in the car healthy? Because it makes a difference if they're healthy kids or they're kids with unstable diabetes or severe asthma. Okay, I would be less inclined if my child had significant chronic conditions, okay, or were immunocompromised. But I will tell you, for me personally, yes, I'm driving and I will have my son and a friend in the car. I do try to have them masked as much as possible. That's, with kids, that's easier said than done, okay? But I do think the masking is very important. I think that has to be, whenever I say masking is important, remember that hand washing is equally as important. Because if we're touching the mask and adjusting it, and then we contaminate the mask, and then we touch our eye, that's a way to get COVID. So that combination, though, of masking and hand hygiene, I think has really slowed this virus down.
Okay, so that's great. And I have a ton of questions to follow up. But again, I want to get to some of our viewers. Beth wants to know, when can we hug our family and friends again?
Yeah, wow. I mean, when we think about the elderly in particular, and that doesn't mean, obviously, as parents, we're not necessarily elderly, but especially, this has been such a difficult group because they have really, this has been the riskiest group that has had the most severe illness and the most deaths. So we have to protect them the most. When we think about protecting vulnerable populations, it is the elderly. So that one is really challenging. And if you're a parent who's older, if you have chronic conditions, you really have to be extra cautious about hugging. I think a hug, if you're wearing a mask and maybe your loved one or friend is wearing a mask and it's quick, and then you sort of go back to that 6-foot type of space and distancing that we talk about that's so important. I think that's probably going to be okay. We do think that spread of the virus it probably takes 10 or 15 minutes of that close exposure. That may be different if you're coughing or sneezing. Just, a simple cough or sneeze could transmit the virus. But in people that are breathing or talking, it probably takes longer contact. So I think hugging is okay. But again, we have to individualize that. If you're someone who's very vulnerable, I hate to say it because I know that it's been an emotionally lonely time, but I would rather wait until we get better therapeutics, until we get a vaccine. And that's what I'd say, but I know that's hard.
Oh, absolutely. You talk about children again and wearing masks, and so many parents out there have questions about what the new school year is going to look like. There's talk about children wearing masks all day. Amy wants to know, is it safe for children, and especially children with asthma, to be wearing a mask in a classroom for 8 hours?
It's such a great question. I'm not a pediatrician. I do want to say that I would ask your pediatrician. I think it's important. First of all, many of us who wear masks know that wearing a mask for 8 hours, continuously, that I don't know how realistic that is. First of all, I think you have to have mask breaks. I think masking is important, but if kids are spaced out 6 feet or more apart, I do think that it may be reasonable to have, mask breaks. Again, that's something that the schools have to discuss with the departments of public health and get guidance on that. But when kids are running around on the field, is it okay to really run full speed for a significant portion of time with a mask on? Not necessarily. So I think we want the mask to be protective, and that's important. And I think the CDC guidance on universal masking when we go out into public is relevant. But I do think that we also have to make sure that we're safe and that we're not unrealistic. I mean, kids going out and running around, it's unlikely that they're going to be able to stay masked for that long.
Yeah. On the topic of masks, are there particular ones that work better than others? You see a lot of people now wearing cloth masks. Is any mask better than no mask? Are there ones people should be looking for that will help sort of prevent the spread?
Yeah, Kristen, that's an important question. So, and this is confusing, okay? And not all masks are equal. So I want to get through it, and I want to try to dispel some myths and tell you what we know and what we don't know. N95 respirators, those are clearly the best filtering masks, but they're of limited supply, and they're only recommended by all groups for people in the medical field, okay? Now, could I envision one day? I can tell you right now, there are experts that are trying to figure out how to potentially mass produce N95 respirators to get it to more of the general public. I don't know what the timeline is on that. I don't know how realistic that is, but that's a goal. And I think people need to know that. Now, next in line are the medical masks. Now, I have a feeling that the CDC would have liked to have recommended medical masks for the general public. The problem is there's also a supply chain problem with that. And when I say supply chain, what I mean is a lot of these masks are made in other countries like China. So we're not necessarily making them en masse. And therefore, I think the CDC felt that we need to limit that again to people who work in the medical field. Now, I want to pause for a second. WHO, the World Health Organization, recently came out with their guidance. What their guidance is to recommend medical masks. First of all, they recommended universal masking like the CDC did about a month ago or more now. Mm-hmm. But for patients 60 and older and those with chronic conditions, the most vulnerable groups, the WHO, was recommending medical masks for that group. okay? And then for everyone else, WHO recommended a 3-fabric mask, a 3-layer fabric mask. What does that mean? That's cotton in the inside, closest to the face, a middle layer, which is a polymer, a polypropylene polymer, and then what's on the exterior is a synthetic that has to be fluid resistant. Now that's what they're recommending. Now you can see how to make that online. If you are the type of person, unlike me, who's all thumbs, if you are more capable and know how to sew, you have to know how to sew, and that's probably the biggest rate limiting step. I think the 3-layer mask makes more sense than the cloth mask, which is what the CDC recommended. But I will tell you, the cloth mask, much easier to put together, okay? So what I would say overall is that masking is important, and ideally, I would like our country to be able to make more of the medical masks so we can get it to the general public. If that were possible, I think that would be a good goal. The N95 respirators need to be reserved for the medical field. And right now, there's been an increase in the public wearing N95 respirators with a valve on it. Now, what I want to point out is that's a problem, okay? And that's not recommended at all. Again, N95s are not recommended, but that one in particular is not recommended because that protects the user, but that valve actually allows all your air to go out and basically hit anyone that's within that 6 feet radius. So we don't want to do that. The hope is that the masks protect not only the user, but the person that's on the receiving end of that. Again, there's been a lot of controversy about which protects more, but it's confusing, but that's where we are right now. CDC, WHO, both recommending universal masking, but the specific type of masks a little bit different.
Wow, how you keep track of all of those facts is beyond me, but thank you for the breakdown on that. It's very insightful. I'm going to get back to some of our questions. Kevin wants to know, why is it so hard for normal or healthy people to get a test, a COVID-19 test?
Okay, testing. Yes, this is an issue. So we want to test more. We know the countries, a lot of them in Asia, that did more widespread testing, they were able to get a handle on this virus in a more expedited way than we have. The United States is doing a lot of testing. Our testing has improved, but still most people in the United States have not been tested. And what I would say is, I think what's most important about testing is smart testing. I'll tell you what I mean by smart testing. Smart testing to me isn't, let's test everyone, because that's unrealistic. We don't have the capability to do that. I'd love it to happen, but we can't. Smart testing, an example of smart testing is testing the most vulnerable patients, okay? Those that are in chronic care facilities, for example, the nursing homes. You test everyone and their staff. That's really important, okay? If you could test everyone coming into a hospital, that would be ideal. Again, many centers don't have the capability to do that. Testing everyone who was out at the protests. They were in big crowds. That would be ideal if we could test everyone. That's what I would call smart testing. And then, very importantly, making sure we test anyone who's part of a cluster of cases. Because before we find a hot spot, once we find a hot spot, at that point, it's really sort of too late. We want to try to get the testing before the hot spot happens. A cluster can form, okay, before the hot spot. So for instance, in Chelsea, the two cities that have been most affected by COVID-19 in Massachusetts are Chelsea and Brockton. If we could have gotten and tested them in a widespread way, and then anyone who was positive made sure that they were isolated at home if they didn't need hospitalization, and anyone who was a close contact, test them as well, and then quarantine anyone who's positive, it may have made it much better. So those are some of the my recommendations. Now, what I would say individually is, if you want to be tested, the Department of Public Health guidance suggests that you should be able to do that. So you want to talk to your provider and your primary care provider to see where to best do that.
Mm-hmm. You briefly mentioned the group of protesters and whether or not, again, testing them ahead of time. We do have a question from Anush and Kelly. They both are asking if the protest, if you think, will lead to a spike in cases. I'm not sure what your thoughts are on that, but
I do. I
potentially.
do. I do. And I'll be the first one to say, I don't know. I don't have a crystal ball. But what's important, what we know, remember, think about person, place, time, and space. Okay. So person, if you have big crowds, you're more likely to spread this. We know that the protests had big crowds. And I want to remind people that while the crowds were diverse, the majority of the protesters were Black Americans, and they have almost a 2.5 times risk of dying from COVID-19 than others. Okay. So we need to protect them as much as possible. The protests worry me. Okay. So that's the person. The place, it was outdoors. That's a good thing. We'll have to come back to that to see how much of a mitigating factor that is. We think that COVID-19 doesn't spread as easily outdoors as indoors, but over time, we're going to see if that's true. Okay, so now, so we talked about person, we talked about space. What about time? Well, we know the longer you spend, sort of face to face, shoulder to shoulder, the more likely you are to transmit the virus. With these protests, we know that people spend hours shoulder to shoulder in big crowds. So that worries me, okay? That worries me for the possibility of a resurgence. And then the last is space. If you're 6 feet or more apart, that is a good space. The likelihood of you transmitting is unlikely unless there's coughing, sneezing, singing, yelling, that type of thing, potentially air conditioning, okay? So I still think, and this is debatable, but I still think that most COVID-19 transmissions occurs with closer contact, all right? So we know with these protests, we know what the crowds look like, so that wasn't good. So 3 out of the 4 were problematic. I am concerned about resurgences. Now, there was masking, and I think that's important. And I do think that could be a major mitigator and lessen the risk. But with anything, masking was uneven in some of these protests.
Yeah, and with those protests taking place over the last couple of weeks, if we were to see a spike, when would we start to see that? Soon?
Right.
Any day now?
Right. We wouldn't see it right away. It's a good point. When you think about the incubation period, the time from you're infected to when you may be contagious or have symptoms, that's about 5 or 6 days. Then it takes often about another week before you start, if you get sick with the virus, that we're going to hear about it. And remember, if you're just at home, we won't necessarily hear about it. If people from the protests are coming into the hospitals and there's an influx, that we'll hear about. So it often can take at least a couple of weeks.
Okay. Anne says her son and his wife are expecting twins in August. Will it be safe for them to come to a hospital and deliver their children, their babies? It is. It would be, correct?
That's right. It is. Congratulations, guys.
Definitely.
Absolutely. I can tell you right now that even when we were at our height, when we had over 100 patients with COVID-19 in the hospital, we were prepared for all of the other patients that come in, whether it's delivery with pregnancy, whether it's heart attacks, strokes. We made sure that we sort of partitioned off the patients that came in with COVID, that they were in a different part of the hospital. We had to dedicate units, and we had to dedicate because their care was so complex. So I've got to tell you guys, you're going to be fine in August. And irrespective of what the hospital looks like, I don't know if you're delivering at South Shore Health, but if you are, we are prepared for you.
Mm-hmm. And this just goes for other medical conditions as well too. I mean, it was in the news, a month ago that emergency rooms were quieter than normal. It's busy, but quieter than normal because they weren't seeing a lot of cases of people coming in with, strokes or heart attacks or falls or what have you. But, people need to continue to seek treatment for their medical conditions, and they need to seek care. The hospitals are still safe, correct?
That's right. And remember something, we have a universal policy now where all staff members are going to come in to see you with masks. In fact, we also have added shields to that as well, okay, for the staff members. And then we're looking for universal masking of the patients coming in too. So we are taking this very seriously. And I have to tell you, we have not had a staff member turn positive in nearly 2 weeks. So that just gives you a sense of the type of infection control measures that's going on, not only in our system, but in most of the hospitals and systems around.
Okay.
Yeah.
Stacy has written a question in about vaccines, and she wants to know how it's possible they are considering vaccines without years of a double-blind study. I mean, it seems quick to get a vaccine in the next few months, right?
It's a great question, Stacy. So basically we have to follow the phases, okay, in order to have a safe and effective vaccine. We are now just entering phase 2. So phase 1 was a safety phase in a small number of patients. We saw that it was safe. We also, as Dr. Fauci says, saw that there seemed to be a very good or robust immune response. Okay, they found neutralizing antibodies. It sounds like a fancy term, but I use it because that's the type of antibodies that really can ultimately lead to protection. It's the antibodies that bind to that certain part of the virus that likes to enter the cells. If you can prevent that and the virus can't enter the cells, well, you know that we're doing well. The next phase is phase 2. So larger number of patients in the hundreds, okay? There, we start to look again at larger number of patients to make sure it's safe, and then to make sure that we still have that antibody level. Because the numbers of patients are much larger, it's also potentially possible to start to see, wow, are we seeing less COVID-19 than we might see in the patients that aren't giving the vaccine? Now, it's not necessarily a placebo-controlled trial, but you're giving hundreds of patients. So if you see very small numbers where you know what the general population is, then you can start to think about, well, maybe this is working. But it's not till phase 3 when we start testing the vaccine in thousands of patients or tens of thousands of patients and compare it to placebo, where you can really tell, yes, this is working, or no, it's not working. Okay, so how could you do it in a shorter period of time? Well, first of all, you're right. You do need a certain amount of time to see whether it's effective. That's just a fact. You need a certain amount of time. But if you are testing it in tens of thousands of patients, potentially around the world, you can get those numbers in faster to see, is this really working? So the effectiveness part, the more numbers of patients you have, you can start to see in a shorter period of time. But then for the safety part of it, it's true. You want to see, you'd like to see 6 months, a year of safety before you're really feeling more confident about it. But again, if we start to hear that after 3 or 4 months with tens of thousands of patients, there seems to be a real difference, and that the vaccine looks effective, much more effective than placebo, well, you're feeling good. And if you have a deadly disease, then it may be possible to get this out faster to the general public.
Yeah. Here's hoping we get one soon for sure. We're jumping around all over the place with different questions. We're going back to masks. This is what makes this Facebook Live so great. Nancy has seen people wearing masks, but also touching them and wearing them incorrectly. She would like just a little bit of an education on what are the proper ways to wear a mask.
Okay.
Or taking one on.
Right. So when you wear a mask, I have a mask right here. Okay.
Perfect.
This is my mask. So so first of all, I already did it wrong. The first thing you want to do is wash your hands. So I just did that with my Purell that's right next to me. Already made a mistake, but we make mistakes. We go back. We want to do it right. Okay. So next, you don't want to touch the inside of the mask. That's the most important thing. The part that's going to be by your face, you do not want to touch that. Okay. And then you want to put it on, and you want to wear it like this. You want to make sure it's covering the chin. You want to make sure it's covering the nose. I'm pressing there. Nose, mouth, you want covered. Okay, this is the way to wear the mask. Now, what you don't want to do is you don't want to do the kind of what I call the bank robber. Okay, you want to. It's important because the mucous membranes are the nose and the mouth and the eyes as well. But obviously, the mask won't cover the eyes. But you want to make sure that it's covering both the nose and the mouth. It's okay to adjust. It's okay to adjust the outside. You'd like to have clean hands ideally. Okay. And after you touch it, you want to try to clean your hands again. Sorry, I forgot that I'm talking with my mask on. We've become so used to practicing with our masks on that I actually forgot that I had it. So, okay, that's probably a good thing.
Yeah, that is a good thing.
So, I think the mask and the hand hygiene really goes hand in hand, and that will protect us from this virus, or at least reduce the likelihood of transmission. It's
Okay.
important.
Okay. And Todd, when you remove the mask and put it aside, and maybe you're doing things around the house and then you have to go back out, should you be using a different mask, a clean one, or can you still reuse that mask?
Okay, so that really depends what's happening. For instance, if I'm in the hospital and I'm wearing this mask and someone coughs in that direction, that mask is contaminated. I'm going to dispose of it. Now, obviously, we have shields, so it's a little different. Again, where I practice, but ideally, the masks probably should be a single extended use, and then you probably want to discard it if there's or if you can spray it with some type of disinfectant again on the outside of it. That's something that you can consider. But for masks in general, you really want to, they're more single use, and then you discard it.
Okay.
Yeah.
All right. Lots of people are waiting for those massage salons and parlors to open. When do you think it will be safe for massage places to open, massage therapy?
Right. So, that's an issue. The governor obviously has laid out the plans for reopening, and based on gating criteria, making sure that we still have decreased cases or percentage of cases. So I believe that the massage and this close personal contact is in phase 3. But let me just look for 1 second, just to I do have this list. I thought someone was going to ask. Okay, phase 2, not phase 3, phase 2, but not at the, we're in phase 2 right now, not at the outset. So that is going to be in the second half of phase 2, hopefully. Again, that relies on the fact that Massachusetts is still doing as well as it's doing now. And we are doing well.
Okay. Jay is asking, if someone has 0 symptoms, is it safe to be near them?
All right, Jay. So again, you guys are obviously not asking easy questions, and this one isn't easy. Interestingly, the WHO 2 days ago came out with a statement that said that they think that patients who are infected and asymptomatic are unlikely to spread this virus, okay, or will rarely spread the virus. Now, the following day, they sort of backed that statement, sort of backtracked and said, we don't know the specifics about the dynamics of viral transmission. This is what I'm going to tell you what I think. That infectivity, unlike SARS, which became more infectious after time, the more symptoms you developed when you were hospitalized, that's when you became more infectious. With COVID-19, it's more like influenza. You're probably most infectious when your symptoms first start. Now, remember, that means that in most hospitalized patients, you're probably not as contagious as you were the week before. I think that's what I want. Now the question is, if you back it up more, what about the day before the symptoms started? I believe that probably that you are able to spread virus at that point. When you're truly asymptomatic, how much that occurs is unclear. I can't give you a percentage, okay? And I think that's the part. So the WHO may actually be correct about this, but I think it's still too soon to say. Now, remember something, when we're doing studies of patients who are actually symptomatic and we follow their close contacts, the majority of the close contacts never develop COVID-19. That's important. In these studies, probably around 12% or 14% of the close contacts become positive when you have a symptomatic patient. We still don't know when you're asymptomatic what that number is, but I think through contact tracing, what WHO was saying was that a lot of the close contacts of asymptomatic patients who are positive, they seem to be negative even more of the time. So the answer is, we have to be careful. I still think the universal masking is important, because remember, one of the reasons that the CDC said we should all go out with masks is because we may be contagious even when we're asymptomatic. I still think that that's probably a true statement, even though I can't quantify it for you.
Okay. Okay. Um, Again, getting back to masks and not touching your face and hand washing, do you foresee in the future it being recommended that we wear some type of eye protection as well? And the reason why I ask that is because we've gotten a question from a viewer asking if sunglasses could be considered a way of protecting your eyes from this virus. What do you
Okay.
think?
Great question. So now, the Lancet, which is the esteemed British medical journal, just came out with an observational study. It was a large observational study. They looked at 172 studies that looked at over 25,000 patient interactions. And what they showed was that masks, eye protection, and social distancing, with 6 feet being twice as protective as 3 feet, all decrease the risk of transmission. So that's important. I do think eye protection has an important role here. CDC has not come out with guidance, so I want to be careful with what I say and understand that this is my opinion right now. I do think that the people who are the most vulnerable, chronic medical conditions like obesity, diabetes, chronic heart disease, chronic lung disease, a weakened immune system, I think those people, when they go out into public, want to consider using eye protection in addition to masking, especially if they're going to be in a crowded area or within 6 feet of other people. But again, we don't have national guidance on that right now, but I think it is something to consider.
Okay, just a couple more questions. The weather's getting warmer. People are out, they're swimming in pools, they're at the beaches. What's your thought on swimming in a pool with a bunch of folks, or being at the beach and being in the water? Any talk about whether this is easily transmitted through water? Just some thoughts on that.
So good news about swimming pools. The CDC actually came out with some guidance on this. It doesn't look like there's any additional transmission in water. It looks like lots of chemicals. The good news is lots of chemicals can kill COVID-19. It's not a particularly hardy virus per se. And so, chlorinated pools should kill that. Remember, the 6-foot rule still persists, though. If you're next to someone in a pool and talking to them for an extended period of time, and you're within 6 feet or within 3 feet, even worse, of course you can transmit the virus. But I don't think most of the transmissions are going to be occurring underwater.
Okay. Man, we've just hit the tip of the iceberg with the questions tonight, honestly, but we do have to wrap. And I appreciate your time as always, Dr. Ellerin. You have such great information, and I want to thank everyone at home who sent in their questions today.
Is there
One
time
last,
for one more?
yeah, what's that?
Is there
Go
time
ahead.
for one more question or no?
Oh, no, I'm going to ask one more question.
Okay.
And my question for you is, out of all of this, what would be your key takeaway, your key messaging for people at home regarding this virus, prevention, taking care of themselves, moving forward into this new normal?
Yes. So I think the biggest, the piece of advice that I want to give is to think about risk stratification. Where do you fall on the spectrum? Are you someone, remember, like we talk about kids fight this virus off like it's a fly. They swat it away. Granted, there are rare cases of those inflammatory syndromes. Even those children typically do well, okay? So, and if you're a healthy adult, most healthy adults do extremely well with this. It can be a problem, and it can take weeks to recover. But if you're in that high risk group, in Massachusetts, 98% of the patients who have died of COVID-19 have had a chronic condition. So if you have a chronic condition, I want you to be extra cautious. Take those extra steps, okay? And you know what those steps are now, okay? But at the same point, as we try to find that new normal, if you're in that healthier group and you're finding that you want to slowly, get out there, there's still ways of doing that safely. And I think we've talked about what that is. So I want to protect the most vulnerable population while also knowing that COVID-19 hasn't disappeared. It's, the weather, even in Arizona right now, cases are increasing. I don't have to tell you the temperature in Arizona is hot. Okay, so we know that COVID-19 can exist in a hot environment. I am hopeful that overall the transmissions will be reduced because of the ultraviolet radiation and the fact that we're outdoors. But again, the protests and sort of our new normal is going to inform us if that's the case. But let's protect the most vulnerable population, and then for the rest of us, I think we want to not put our foot right on the accelerator, but we're going to accelerate faster than the vulnerable groups will.
Gotcha. Thank you so much for all this wonderful information. It's always so great to talk with you. We want to thank everyone for sending in their questions tonight and joining us. If you missed tonight's segment and you want to take a peek at some of the things that Dr. Ellerin shared with us, you can visit onehealthyboston.com. All the information will be there. We want to say thank you to WCVB, who always gets us live and on the air for this. Great talking with you again. Everyone stay safe, wear your mask, and as our CEO at South Shore Health says, be kind to each other. So have a great night, everyone. Thank you.